The CDC's Advisory Committee on Immunization Practices voted Wednesday to recommend that Pfizer-BioNTech's COVID vaccine be administered to 12 to 15-year-old adolescents, following an FDA decision earlier this week to expand the vaccine's emergency use authorization to include this age group. The full recommendation, which passed on a vote of 14-0, 1 recusal, reads: the Pfizer-BioNTech COVID-19 vaccine is recommended for persons 12 to 15 years of age in the U.S. population under the FDA's Emergency Use Authorization. Scientists and public health experts are already urging parents to vaccinate children in this age group, citing both the risks of COVID itself as well as the importance of keeping the spread of the disease contained. That's particularly the case as the more contagious B.1.1.7 variant of the disease now constitutes nearly two-thirds of cases in the U.S. In addition, children are also susceptible to long COVID, a condition where COVID symptoms can linger in infected patients for days, or even weeks. Earlier Wednesday, the American Academy of Pediatrics issued a statement recommending that all eligible children over the age of 12 be vaccinated. More than 3.8 million children have been infected with this virus since the beginning of the pandemic, and children have suffered in many other ways, the statement reads. While most children do not get severely ill from COVID-19, thousands have been hospitalized and hundreds have died. The Advisory Committee on Immunization Practices is a group of 15 medical and public health experts who provide advice about best practices for vaccinations. Although not legally binding, its recommendations are highly influential in determining how governments and health systems administer vaccines. One issue considered by the committee in making its vote was to determine whether the COVID vaccine could be co-administered with other adolescent vaccines, or whether it should be administered separately. Previously, a 14-day interval had been recommended between COVID vaccines and other vaccines for all age groups. The committee ultimately determined this timing interval was no longer needed for either adults or adolescents. Pfizer and BioNTech reported in March that in clinical trials, its vaccine had 100% efficacy at preventing COVID-19 among the 12 to 15 age group, with antibody responses exceeding those of the 16 to 25 age group. Across the globe, we are longing for a normal life. This is especially true for our children, BioNTech CEO Ugur Sahin said in a statement at the time. The initial results we have seen in the adolescent studies suggest that children are particularly well protected by vaccination. Full coverage and live updates on the coronavirus.